Hi, my name is student Dr. Harrison Stubbs.
My name is student Dr. Sarah Sharif.
And today we will be presenting common MRI artifacts mistaken for intracranial tumors. MRI is a crucial imaging technique used across most medical fields. With approximately 1.6 million errors made in imaging interpretation annually, we seek to diminish confusion created by artifacts, specifically as they pertain to the misinterpretation of intracranial tumors. Magnetic susceptibility artifacts result from inhomogeneous magnetic fields. These artifacts are especially prevalent in DWI and GRE modalities, and they appear as geometric disturbances or signal drop halos that can be misinterpreted as glioblastomas, meningiomas, and hemorrhagic metastatic tumors. Utilizing shortened echo time or spin echo are two ways that you can reduce the incidence of these artifacts. Ventricular CSF pulsation artifacts are created by turbulent CSF flow and appears hyperintense, heterogeneous signaling of the ventricles that may resemble intracranial masses such as ependymomas. They are more likely to occur with FLAIR imaging and in cases of ventriculomegaly and increased age. To reduce the artifact, correlate findings clinically or alter the protocols to utilize 3D FLAIR or more robust slices.
Vascular pulsation artifact is a form of ghosting image misrepresentation. This type of artifact appears on MRI when the periodic pulsatile flow of blood in vessels causes exaggerated hyperintensity. Common throughout the cerebrum and cerebellum near the subarachnoid spaces, this artifact takes shape as either circular or linear appearing hyperintensities depending on the orientation of the vascular flow. It is more prominent in contrast studies and can be mistaken for metastatic tumor foci. In order to avoid mistaking this artifact for a pathologic process, a helpful method while imaging is switching the direction of the frequency and phase encoding gradients of image acquisition and cardiac gating, which synchronizes MRI image acquisition to an ECG. The next artifact is chemical shift, also known as misregistration. This MRI artifact causes an altered appearance of an interface between two substances of different compositions. Typically, this occurs between a substance, such as fat, and a liquid, most commonly water. On a curvilinear structure, this is portrayed as a black border on the side of the interface, while the other side of the structure appears to have a bright border. This shift of positions of fat and water can be mistaken for a pathologic process, such as an intracranial mass. Fat suppression is a helpful technique in avoiding chemical shift artifact. The intensity specific to the lipid substance is decreased relative to the adjacent liquid material at the interface. Another way to reduce this artifact is by widening the bandwidth. Increasing the difference in frequency will decrease the amount of shift of the artifact. Lastly, we have central point artifact, which is commonly caused by direct current voltage inconsistencies that result in distortion of the true image. This appears as a well-circumscribed focal hyperintensity and becomes increasingly concerning with involvement of the pons or midbrain. It can be mistaken for brain neoplasms such as focal brainstem glioma, meningioma, or possible metastasis. Recognizing that the image disturbance lies in the direct center of the image will be a quick identifier of these artifacts. Typically, the software will account for direct current changes to minimize artifact presence. However, if it appears, it is recommended to repeat the sequence.